I work at a charity called the Conservation Volunteers, and we do a number of different programs related to health and well-being. And in particular, we're running a program at the moment called 5 Ways Well, which is using different ways of connecting people to nature and using that as a way of improving mental well-being. Evidencing is the big challenge we have. You can speak to a lot of people on the programs who know that it works or they feel that it works for them, but evidencing that to other people is more difficult. So we have used some surveys, we have used some case studies, but we're really interested in using a more formal framework to try and capture some of the information about what impact this is really having.
My name is David Graham. I'm a business development manager with the Conservation Volunteers. I'm interested in this framework primarily due to my work in developing bids and funding bids, so it would be to find a coherent way to build the framework into funding applications moving forward.
I'm Bryony White and I work for Conservation Volunteers and I'll be applying the framework at my project at Gartnavel Hospital, which is about working with patients and the local community on horticulture and environmental projects.
I'm Rebecca Strofton. I'm a Senior Project Officer with the Conservation Volunteers and I'm looking to apply the framework to the Community Rewilding project that I'm running, which aims to improve community green spaces by getting the communities involved in them and improving people's connection to nature.
Hi, I'm Dominic Hall. I'm an operations leader at the Conservation Volunteers, and I'm really interested in using the framework to evaluate a number of our different health programmes and talk more effectively about the impact that they have.
My name is David Meakin. I work for the Conservation Volunteers as a Green Space for Health Senior Project Officer down at University Hospital at Ayr and Ailsa. My project is all about engaging staff, patients and local community about using the green space as a source of green exercise programmes and bettering health and prevention.
So I'm Paul Barclay. I work for the Conservation Volunteers on a project called 5 Ways Well, which is using a 5 Ways Well approach combined with exposure to nature and green spaces to help improve people's mental well-being.
So Dom, the last time we met was a few months ago now, and we spoke about the possibility of coming together and using the ABIF, Measuring Humanity, the concept behind this, to work with TCV. So do you want to tell us a bit more about the journey to now?
Yeah, well, it's quite nice because I think it was about 3 or 4 months ago now when we met, and it was your introduction, I suppose, to some of the work that we've been doing around a 5 Ways Well programme, so a programme to get people into the outdoors, to look at benefits for people's mental health of being outdoors. So I guess we were introducing that programme to you then, and since then it's been nice. We've been able to work together a bit, you looking at some of the work we've done on some of the pilot programmes, and then I guess today's been the first step of looking at how we can work together better over the next few years to try and evaluate some of these programmes and use the framework in a number of the different programmes that we're doing, really. So
I think part of the things that you challenged by as a group of practitioners working with these kind of green space, if you like, interventions or doing different things within communities, how do you actually show that you're improving health and well-being or reducing inequalities? How do you actually do that? So I mean, what are some of the challenges that you find in terms of evaluation for your groups?
There's a lot of challenges. I think pitching things at the right level, so you want to speak to people about their experience, and yet a lot of the measures that you feel like you maybe should be using or you're pushed into using or maybe don't feel that appropriate. They feel very very reductionist compared to the impact that you're having. So to give an example, a lot of the programs we do might be mainly about the physical health of people, getting them outdoors more, but we know that actually some of the big benefits they have are about their connection to other people, reducing their isolation and their loneliness, about their mental well-being. So there's a whole spectrum of different things, and it's really hard to capture that. So that's what's interesting for us about using the framework, is trying to get that wider picture of what people are actually experiencing in the programme, rather than what we might preconceive they might be experiencing.
I know, it's really one of the things that kind of struck me, because today we had, was it 5 or 6 practitioners in a room sort of learning about the concepts behind the framework, some of the underpinning indicators and thinking. And it's really interesting that some of the things that we're up against initially as practitioners is thinking, well, how are we going to do this when we're maybe working with groups who are struggling for whatever reason, or may not have the same capacity, in different ways.
Doing is, for them, very much their reason for being there. And to say to them, well, today we're not going to do, we're going to, and it's got nothing to do with the gardens, it's not like a planning meeting or anything like that, it's to do with how you feel. These are West Coast of Scotland men. they don't do feel very much.
The context, is that we have trouble with a simple questionnaire. With a lot of participants, they don't either. Well, all sorts of barriers, as you mentioned. They might not understand it. They might not want to engage in it. They might not feel that they have a mental health issue. Therefore, why are we asking the questions about how do they feel? Or maybe worse, the other way around. They do know they've got a mental health issue, and why are you asking me? You're not the doctor. You're just here to get outdoors. So I think all of this. Well, I think we're just trying to understand how or think through how could we use this with a group, which I guess comes back to my question about the number, because I thought, well, maybe we could facilitate a question to them about which is most important to you. Are you here to get more exercise, or are you here because you feel like it might help you feel happier? There might be a way of us framing this which we felt was authentic for us.
Absolutely.
And worked for the group.
And I think for me that really struck me as being really fascinating about today was how are we going to start speaking the language of the community member in order to evidence, if you like, or show that something has happened as a result of our project.
Yeah, that's absolutely true. I think that's a real challenge that we have, is that we work on the ground with communities, and we want to speak their language and understand that, like I said, their personal experience, I suppose. And yeah, it's really important that we can translate that or relate that to bigger impacts that are important on a government level, on a policy level as well. So yeah, it's trying to translate or link up that language, I suppose, is a real challenge, but is really important, I think, in terms of securing those services in the future, in terms of even sometimes our own staff understanding what they're trying to achieve and what impact they're trying to have. So it's been a really useful day from that point of view, just I think teasing out some of those challenges and thinking of practical ways we may be able to deal with them.
And really interestingly enough, it's how might we actually be able to change shift the perceptions and the attitudes of people even within your own workforce who maybe don't feel that they have confidence somehow to go out, and they're doing phenomenal work in communities and they're doing great things. How might we be able to just work with our own sort of staff as well as community members to go out there and say, actually, we are doing something that's important here, and here's why, and building capacity internally as well as within the community.
Absolutely, yeah. I mean, I guess this is something I've taken away from today, actually, which I hadn't really thought about before, is that evaluation is as much about facilitation as anything else, and that's a skill which not everybody has, and not everybody feels confident starting with a blank page and just saying, why do you think you're here and what do you think you're going to get out of it, which is a really important thing. And I think that needs a lot of confidence building and skill building amongst the staff who are going to deliver it. And then on a bigger scale, I think, giving people the confidence to shout a bit more about what they're doing. I think all of the people who work on our projects and many of the participants know that these projects are really important, but somehow they feel like other people don't understand or they don't realise how important it is. So I think that's another area where confidence, for people to more clearly advocate for what they're trying to do is and that's both participants and staff, I think, as well.
This is the stuff that we're being asked to measure if we're to prove these things at an academic level.
He'd just go off and get his rake.
Right, so your job as a practitioner is to get your rake and rake with him and try and understand what being happy means to him. Right? And that...
Raking. Seriously, he said that to me. Yeah. Happy raking.
Happy
For him,
raking.
raking is meditation.
There we go. Well, there you go.
But I think that's what's interesting, because that's what we're trying to identify, is what is it about raking that fits this, that then Marissa can then say, actually what our programme is doing is not affecting raking or tea drinking, it's affecting affect, in fact.
And working creatively as well. I mean, that's something that came out as well. People are like, hang on a minute, we can do things creatively within communities. We don't have to just go in and say, right, on a scale of 1 to 10. Not that that's a bad thing, but may not necessarily give you the insights that you're looking for.
Yeah, definitely. I think in the past we've kind of felt there's a need to evaluate these things, and that's done through questionnaires and surveys and 1 to 10 scores. And absolutely, I think that has a place and it works in some places. But actually, I think what today's been about as well for me is realising that there is a place for some of the other stuff that actually people have actually felt maybe instinctively is important, but have maybe thought, oh, that's not proper evaluation. So yeah, I think people sometimes feel that things they feel are important for evaluation aren't more widely valued. They think that people will look down perhaps on the way that they might choose to research things. And I think that's what's been today really good, is actually realising that there is a way that some of the softer, some of the more different skills can be more firmly evaluated and more academically robustly evaluated, which I think has been really nice for my staff to hear, because I think they may have otherwise felt like they can't do this or it's not important really.
They're not allowed to bring themselves into the research. They're not allowed to reflect on their own journeys or their own diaries or their own whatever it is that they've experienced. And somehow they've kind of left themselves out of this conversation rather than putting themselves right there next to community members as part of the conversation.
Yeah, again, that's something we've talked about a bit as a staff team before. And again, maybe just thought it's not as important or it's a side bit of the project. Whereas actually a lot of the projects we're trying to do, it's really demonstrating how things might work, and a lot of that is actually about the staff and their reflections on what things have worked and what they've learnt, and I think we probably haven't valued that ourselves enough before. We haven't put enough emphasis on that, so that's been really useful today as well.
Yeah. So moving forward, part of a bigger conversation. Yeah. So how might this form part of a bigger conversation, a bigger inquiry moving forward then?
I think we've already progressed quite a lot really in the discussions that we've had. We started off with some really small scale pilots where really for us as an organisation, and I think for you as well, like it was a very early stages of partnership, understanding what we did and us trying to understand a bit more about the framework. Now we have a number of staff trained up. We've got a number of programmes that we're going to start to develop how we can use the framework with. And I think the big picture of it is that we have to plan for the longer term, how we can roll these things out, how we can use them on longer term programmes. But it's been a big step forward, I think, actually just getting more staff to understand how that might work and get them to start thinking about that now rather than just waiting until potentially that bigger programme comes along. So
great stuff.